Hello everyone. So today we'll be discussing in brief about a very near and dear topic to all the gynecologists, that is PCOS or PCOD. So many of the patients which come to our OPD, at least 1/4 of the patients that we see on a daily basis are suffering from irregular cycles or some or the other form or combination of PCOS symptoms. So is PCOD and PCOS the same? What are the common symptoms of PCOD? How do you diagnose that you have PCOD? What are the causes of PCOD? And what are the different treatment options for PCOD or PCOS? So this will be covering in this short topic. So most importantly, the symptoms, how to identify whether you have PCOD or PCOS is the most common being irregular cycles or delayed periods. So if your cycles were regular prior to the problem that you're facing this problem since the last 2 to 3 months, that you've put on a little bit of weight, or you're experiencing delay in your menstrual cycle, you've suddenly acne on your face. Back acne is one more common symptom of PCOS, and plus hirsutism. Hirsutism is facial hair growth, which is also very, very commonly seen in patients with PCOD or PCOS. Secondly, is PCOD different than PCOS? Definitely the answer is yes. PCOD is polycystic ovarian disease, and PCOS is polycystic ovarian syndrome. So when the disease is particularly limited to the ovary, we call it PCOD. And syndrome is when it has transformed into a metabolic disorder wherein there is a lot of insulin resistance. There is hormonal imbalance to the extent that it has affected the thyroid gland also. There is a significant increase in weight, and there is a significant derangement of the hormonal levels. And that is when the disease is transformed into the syndrome. So, what this PCOD or PCOS entails is first and foremost the disturbance of the hormonal circadian rhythm, so to speak. Every month there is a rise and fall of particular hormones from the ovary, the pituitary, and the thyroid, which results in ovulation, and that results eventually after 2 weeks into a normal menstrual cycle of the female. So this disturbance of the hormones due to insulin resistance or due to any other cause of imbalance will disrupt the ovulation date. So after the ovulation, generally after 2 weeks, the lady is supposed to have menstruation or menstrual period. So because the ovulation doesn't happen, the period also doesn't happen. So this is a simple explanation of PCOD and PCOS, wherein we can understand why your periods are delayed. Whereas when it comes to acne, when it comes to facial hair or blackening of your neck and back area, which is also a very common symptom in PCOD, that is definitely a result of insulin resistance. So insulin resistance means insulin is a hormone that is secreted by our pancreas, which is very, very important for us to metabolize glucose. So whatever we eat, insulin converts it into usable energy, and insulin is also very, very important in the hormonal cycle of ovaries and thyroid and pituitary gland. So when the insulin resistance rises, our body is unable to use the glucose to supplement our energy source. So we are unable to use the food that we eat as an energy source, and in turn there is a more and more requirement of insulin by the body. So there are particular insulin receptors in our body which use the insulin and convert the glucose that we eat into usable energy. So when this mechanism is disrupted, we call this as insulin resistance. So when this insulin resistance happens, there is more and more insulin produced by the pancreas, because our body is getting signal that, oh, there is a lot of insulin resistance. This insulin is not enough. We want more, we need more. So the pancreas starts producing more and more insulin. And this blackening and the acne and the hirsutism is a result of that. And plus, dehydroepiandrosterone is a type of testosterone which is increased in PCOS. So all of these symptoms of PCOD and PCOS are combinedly called as polycystic ovarian syndrome, wherein it has started affecting your metabolic cycle also. So it is no longer limited to ovary and your periodic cycle, but it has also started to affect the other organs of the body as well. So what are the important, treatment options? So definitely treatment options will be dependent on the need of the patient or the need of the couple. If you are a teenager, if you are, non-desirous of pregnancy, if you just want to regularize your cycles, the treatment will be different. If you are a couple who is desirous of fertility, the treatment option will be completely different. Nowadays, a lot of practitioners use OC pills to treat PCOD, which is, in my opinion, absolutely wrong. It should not be used as a vice versa treatment. Just because you have PCOD, you should be given OC pills. That is absolutely wrong, because it will give you a false sense of relief that just because of PCOD, you will get your periods on time. But the underlying problem of PCOD will never be solved unless and until you work on it. So it is just like putting a band-aid on a big wound that you are not, seeing. You need to put stitches, you need to clean the wound, you need to go to the depth of the problem, you need to understand why the PCOS is happening, you need to, have contingency plans, you need to have different treatment options rather than just giving OC pills and getting regular periods for 2 to 3 months. When you stop taking OC pills, your periods are going to go back to being irregular. So we've not achieved anything apart from, just a stopgap mechanism, so to speak. So that is absolute no. Plus, if you are done with your family, suppose if you are a couple, you already have 2 kids, thankfully, you've not had any problem in conceiving in spite of PCOD, but now you want to control your PCOD. So the treatment for that will be completely different. So when you connect with your doctor, please do let them know that what stage of life or reproductive period you are in, what are your plans, what are you desirous of, so that the treatment plan can be tailored according to your lifestyle and your liking. Thank you so much.